Let's begin the heart and the heart's role in the cardiovascular system. The heart beats about 100,000 times a day, pumps about 8,000 liters of blood a day. It pumps through the pulmonary circuit vessels to and from the lungs, and it pumps through the systemic circuit to and from the rest of the body tissues. Arteries carry blood away from the heart chambers. Away. Veins return blood to the heart. The heart has four muscular chambers. The right atrium receives blood from the systemic circuit. The right ventricle pumps blood into the pulmonary circuit. The left atrium receives blood from the pulmonary circuit, and the left ventricle pumps blood into the systemic circuit. This picture shows you the pulmonary circuit and the systemic circuit and the flow of blood through the body. The heart's location is behind the sternum and is surrounded by a pericardial cavity, and it's lined by a serous membrane called the pericardium. The pericardial fluid is found between the layers and reduces friction because the heart is constantly pumping. This shows you the location of the heart behind the sternum and between the lungs. This shows you the base of the heart, the superior end, the inferior end, and the heart is about the size of a fist. Let's go over the surface anatomy of the heart. The superior end of the heart is called the base. It has the great vessels, the aorta, the vena cava, the pulmonary arteries, and the pulmonary veins. The inferior end of the heart is called the apex. It's the pointed tip. This illustrates the superior end of the heart and the apex of the heart. This picture shows you the left atrium, left ventricle, right atrium, right ventricle, and the landmarks. The heart has three layers. The epicardium covers the outer surface of the heart. The myocardium contains the cardiac muscle cells, and then the endocardium covers the inside chambers and the heart valves. The AV valves are located between the atria and the ventricles. Heart murmurs are when small amounts of blood are going back up into the atria. It's a regurgitation, and the proper name for this backflow is called a heart murmur. Coronary circulation. When the coronary vessels become blocked, they call this a myocardial infarction, MI, or heart attack. This is when the coronary vessels become blocked and the cardiac tissue has a chance of dying or does die. Here we see the base of the heart and the apex, and we see all the arteries. We see the right coronary artery, the left coronary artery, the left anterior descending artery. When these arteries become blocked or occluded, that can lead to a heart attack or an MI or a myocardial infarction. If there's a lack of oxygen to the heart muscle itself, the heart muscle tissue can die. 99% of all cardiac muscle cells are contractile cells. This chart illustrates the depolarization, plateau, and repolarization of the heart muscle contracting. There's an electrical system called a conducting system. There are pacemaker cells, and there are nodal cells that reach threshold and fire first. There's a pacemaker called an SA node. It's in the posterior right atrium, and it's the cardiac pacemaker. The atria contract from the top down, and the ventricles contract from the bottom up. If the SA node fails, the AV node takes over at about 40 to 60 beats per minute. Sometimes we have clinical problems with pacemaker activity. Bradycardia is a heart rate slower than 60 beats per minute. Tachycardia is a heart rate faster than 100 beats per minute. An ectopic pacemaker is when abnormal cells generate abnormal signals. We can measure our heart activity with an ECG or an EKG. It's an electrical events of the heart. There are things called cardiac arrhythmias or abnormal cardiac activity. An EKG measures the P wave, that's atrial depolarization, the QRX complex, that's ventricular depolarization, and the T wave, which is ventricular repolarization. These images illustrate the P wave, the QRS complex, and the T wave, and this is an EKG strip or an EKG reading. And this shows you the P wave with the depolarization of the atria, the QRX complex with the depolarization of the ventricles, and then the T wave with the repolarization of the ventricles. Now let's begin the cardiac cycle. It's the period between the start of one heartbeat and the start of the next. It includes alternating systole, contraction of the chamber, and diastole, relaxation. During diastole, the chambers are filling with blood. During systole, the chambers are ejecting blood. Blood flows due to the increase in pressures in one chamber above and the pressure in the next chamber. Blood pressure refers to the pressure in the atrial vessels. A sphygmomanometer is used to measure the blood pressure. There are certain heart sounds, and there are certain tools used to listen to the heart. A stethoscope is a tool that a doctor or nurse uses to listen to the sounds of the heart. The first sound is lub. That's due to the closing of the atrioventricular valves. The second heart sound is dub, and that's due to the closing of the semilunar valves. The third and fourth sounds are very faint, but it's due to the atrial contraction and the blood flow into the ventricles. There's something called autonomic innervation of the heart. The pacemaker cells are autonomous, but they're modified by the autonomic nervous system. The parasympathetic system slows the heart rate by the vagus nerves. The sympathetic system speeds up the heart rate, and it does that through fight or flight, and they extend from the cervical and upper thoracic ganglia. The heart rate is the primary effect of the SA node, or the pacemaker of the heart. However, the parasympathetic can release acetylcholine, a neurotransmitter, and that can slow the heart rate, where the sympathetic pathway can release norepinephrine, a hormone, to increase the heart rate. The cardioacceleratory center is the sympathetic pathway, and the cardioinhibitory center is the parasympathetic pathway. They respond to changes in blood pressure, arterial concentrations of oxygen and carbon dioxide, and they're monitored by baro and chemoreceptors. Baroreceptors deal with blood pressure, chemoreceptors deal with O2 and CO2 concentration levels. Let's talk about the vascular pathway of blood flow. Arteries leave the heart and branch into arterioles, which feed organs, and branch into capillaries where chemical and gaseous exchange occurs, and drain into venules, the smallest vessels of the venous system, and veins, which return blood to the atria of the heart. The first type of arteries leaving the heart are elastic arteries. They're stretched during systole, they're relaxed during diastole, and they prevent very high pressure during systole, but also prevent very low pressure during diastole. Capillaries are ideal for diffusion between plasma and interstitial fluid. This shows you the blood flow from the elastic artery to the muscular artery to the arterial to the capillary to the venule to the medium-sized vein to the large vein. Veins collect blood from tissues and organs and return it to the heart. Normal blood flow equals cardiac output. Increased cardiac output leads to increased flow through the capillaries. Decreased cardiac output leads to reduced flow. Increased pressure increases flow. Increased resistance decreases flow. Pressure. Pressure is when liquids exert hydrostatic pressure in all directions. Arterial pressure is called blood pressure. This is what we measure. Viscosity is thickness. It's due to interactions between molecules and suspended materials in a liquid. Low viscosity fluids flow at low pressures. High viscosity fluids flow only under high pressure. blood viscosity is normally stable. Our blood pressure is maintained by hormonal and neural mechanisms. Let's talk about blood pressure. Systolic blood pressure, SP, is peak and occurs during ventricular contraction. Diastolic pressure is the minimum and occurs at the end of ventricular relaxation. Blood pressure is recorded as systolic over diastolic. An example would be 120 over 80 milligrams of mercury. The pulse is alternating changes in blood pressure. Pulse pressure is the difference between systolic and diastolic pressure. For example, 120 minus 80 equals 40 pulse pressure. So it's systolic minus diastolic pressure. Now let's begin with the pulmonary circuit. Blood exits the right ventricle through the pulmonary trunk. It branches into left and right pulmonary arteries and it enters the lungs. Oxygenated blood returns to the left atrium through the left and right superior and inferior pulmonary veins. Now let's go over the systemic circuit. Supplies of oxygenated blood to all non-pulmonary tissues. Oxygenated blood leaves the left ventricle through the aorta, the largest artery of the body, and it returns deoxygenated blood into the right atrium, and it contains 84% of the total blood volume. Make sure you know this picture, know the right subclavian artery and the left subclavian and the axillary artery. The subclavian arteries supply the arms, chest wall, shoulders, neck, back, and central nervous system. The common carotid arteries ascend up into the neck and divide. There's the external carotid artery and the internal carotid artery. This picture illustrates and shows the common carotid artery and the subclavian. There are two major arteries of the trunk, the descending aorta and the phrenic artery. Make sure you know the major arteries of the trunk, specifically the renal arteries supply the kidneys, the gonadal arteries, the gonads, the adrenal arteries supply the adrenal glands, and the lumbar artery supply the spinal cord and abdominal wall. Here we see all the veins in the cardiovascular system. We're going to go through a few major areas. The systemic veins. There's a venous network that returns blood to the heart. Arteries and veins run parallel. They often have similar names. Major veins in the neck and limbs are different than arteries. Arteries are located deep within the body. Veins are usually a set of two. One is deep and the other is superficial, and they aid in body temperature control. The superior vena cava receives blood from the head and neck, upper limbs, shoulders, and chest, and they return blood to the heart. This shows you the superior vena cava and the veins returning blood to the heart. This shows you the inferior vena cava and the blood returning from the trunk and legs. The cardiovascular system supplies all other systems with oxygen, hormones, nutrients, and white blood cells. It removes carbon dioxide and metabolic waste. It is one of the most important systems within the human body. All the systems are interdependent. This shows you the integration of the cardiovascular system with all the other systems in the body.